My name is Wendy Chaboyer. I'm a professor of nursing at Griffith University, and I'm also the director of a National Research Center of Excellence in Nursing, funded by our federal government's National Health and Medical Research Council. Well, I guess when I was working clinically as a nurse in intensive care, I saw how we were providing patient care, and we did, I thought, a really good job, but I did think there was areas we could improve on, and so it made me start questioning, I guess, how can we better provide care for patients? Over the subsequent years and study, I realized that one of the ways we can do that is by undertaking research to try to demonstrate that what we're doing maybe is good or there's better ways of doing it. My area of research has been in acute and critical care nursing for the last 15 or so years, and I particularly was interested in the area of what we term patient safety. About 15 years ago, a number of reports came out, studies around the adverse events that patients experience when they're in hospital. And in fact, about 1 in 10 patients gets harmed as a result of the care that we provide them, not their condition that brought them to hospital. And I was thinking that actually nurses were with patients 24/7. We have an opportunity to be a safety mechanism for our patients. And so I started thinking about the nurse's role as mitigating risk for the patient, and that brought me to focusing on a number of areas in relation to how can we improve nursing care and my research. I guess one of the areas under the umbrella of patient safety is clinical handover. That is when we move patients from one service or one set of health practitioners to another. And I focused in the early days of my research on the movement of the patients from the ICU to the ward, or the ICU discharge process. And one of the things that we identified is that there was a number of times in that movement of that process that patients were actually at risk. So we developed an advanced practice nursing role, the ICU liaison nurse role, to try and help in that transition of the patients, but also help the ward staff in terms of dealing with patients with complex care needs or patients who are deteriorating. So now, in about a quarter of the ICUs in Australia, we have these ICU liaison nurses who are there to try to help patients in their transition and prevent adverse events during that time. Well, I think one of the biggest things that's occurring right now is a recognition that patients should be active participants in their care. We're currently undertaking a study funded by the Australian Research Council that's focusing on how do patients and how do nursing staff want more active participation. What are the barriers? What can we do to help patients become more active? And we've put together a team here at Griffith and colleagues at Deakin who are focusing on trying to change the way we practice in the future, I guess, to more involve patients and their family in care.